Okay, so it's May 28th, 2025. And yeah, COVID-19 is still part of the conversation. It keeps evolving.
It really does. Never stays still for long, does it?
No, it doesn't. And look, I know you might be thinking, oh, not more COVID news. I totally get that feeling, believe me. There's definitely some fatigue out there.
For sure. Understandable.
But right now, there are these two new Omicron subvariants that are kind of making waves. NB.1.8.1 and LF.7.
Hmm.
The WHO has actually put them on their watch list, so, that means we probably should pay attention.
Absolutely. It's easy to feel like the worst is behind us, especially compared to, the huge disruptions early on. But this virus, it's incredibly adaptable.
Adaptable is one word for it. So these two, NB.1.8.1 and LF.7, what's the deal? Are they spreading faster?
Yeah, that seems to be the main thing initially. They appear to be even better at spreading than the Omicron versions we've seen before. Think of it like, I don't know, some really juicy gossip going around.
Okay. Or a viral cat video, maybe.
Exactly. Something that just takes off really, really quickly. They seem to have that knack.
Right. The Usain Bolts of the virus world.
Yeah.
For now, anyway. So the big question, the one I think everyone listening is asking is, okay, faster, but are they worse? Are they making people sicker?
That's the crucial question, isn't it? And the one everyone's tracking very, very closely. The somewhat encouraging news, based on the early data we have, is that we're not seeing a big jump in how severe the illness is.
Okay.
Compared to other recent strains anyway. Hospitalization rates aren't really spiking where these variants are popping up, but, and this is a big but, it's still very early days. We're still gathering information, figuring out the full picture. That could change.
Right. Still unfolding. Okay. And I saw reports that India is already reacting. Some states are bringing back measures.
Yes, that's right. Several states have started reinstating some of the standard COVID protocols, the SOPs, and the central government is definitely pushing for vigilance, telling people to, stay alert.
Okay. Feels a bit like deja vu, but maybe a less intense version this time, hopefully. Maybe we should just quickly look back at how things played out in India before, because it feels like a lifetime ago sometimes.
It does. But yeah, looking back, after 2020, India went through, what, 4 pretty major waves, big ones. They brought lockdowns. Our hospitals were under immense strain. Society just changed. It was huge.
I remember those images, the empty street, the constant news. It felt relentless.
Yeah.
Then things started opening up more around 2022, and we had those mini surges.
Exactly. Mini surges is a good term. They happened. Cases went up, but they weren't quite as overwhelming, and they tended to fade faster.
Yeah.
Didn't cause the same level of crisis,
Right.
but they were a constant reminder, weren't they, that the virus was still around, still capable of causing trouble.
Yeah, definitely kept us on our toes. So where do NB.1.8.1 and LF.7 fit in this timeline? Clearly not like the Delta wave in 2021, right? That was something else entirely.
Yeah. Oh, definitely not on that scale in terms of severity, based on what we see now. Delta was terrifying, truly. This current rise, it absolutely needs attention. It needs these proactive steps, but the evidence just doesn't point to that level of danger right now.
Okay.
Still, the fact that governments are acting, bringing back rules, shows they're taking the potential risk seriously, trying to prevent a bigger flare-up.
Makes sense. Better safe than sorry. So tell me more about these rules, these SOPs coming back in some states. What does that actually look like for people on the ground?
Well, what's often the things we remember, mandatory masks, especially indoors and public places or crowded areas. That's a big one. Then there's the emphasis again on social distancing, keeping some space. And a really key part is ramping up testing again.
More testing. Makes sense for tracking it.
Yeah.
What about hospitals? Are they gearing up just in case?
Yes, definitely. Alongside more testing, there's a push to make sure hospitals are prepared, checking bed availability, making sure ventilators are working, having enough oxygen supply. It's that whole preparedness drill.
Right, getting the defenses ready. But it's not just about official rules, is it? There's also what we do individually, that whole COVID-appropriate behavior thing.
Absolutely critical. Public awareness campaigns are kicking back in, reminding everyone about the basics. Masking up, keeping distance, washing hands really well and often. Try not to touch your face.
The classics.
Classics. They seem simple, but when lots of people do them, it genuinely makes a difference in slowing things down.
Okay, so that's the response side. Let's dig into the why a bit more. You said the WHO is watching these two, NB.1.8.1 and LF.7, because of concerning traits. What exactly is concerning about them? What makes them stand out?
The main thing scientists are looking at is their potential for what's called immune
It's
evasion.
immune evasion. Okay.
Yeah, basically, it means they might be a bit better at getting around the immunity you've built up, whether that's from having COVID before or from the vaccines.
Okay.
It's like the virus has changed its disguise slightly, so our immune system doesn't recognize it quite as easily.
Hmm.
Like picking the lock, maybe, dodging the key that used to work perfectly.
That makes sense. So does that mean, oh God, does that mean the vaccines don't work anymore? Because that's going to worry people.
No, no, it's really important to be clear here. Vaccines, and especially the booster shots, are still our best defense against getting seriously ill, ending up in hospital, or worse.
Okay.
These variants might mean more breakthrough infections, getting sick even if you're vaccinated. That might happen more. But the vaccines are still doing a crucial job protecting against the severe outcomes. Think of it like maybe a better raincoat. You might still get a bit damp and heavy rain, but you won't get soaked to the bone.
Right. Okay. That's a really important point. So lower risk of the really bad stuff, even with breakthrough cases. What about that higher transmissibility, but maybe not higher severity? Is that holding up?
So far, yes. The data we have suggests NB.1.8.1 and LF.7 do spread more easily between people. They're efficient that way. But the encouraging part, we haven't yet seen a big rise in the proportion of those cases becoming severe or fatal.
Okay.
But again, early days, preliminary findings. Scientists are working hard on this, researching constantly. Viruses can be tricky, We need to keep watching.
Absolutely. Can't get complacent. And this isn't just happening in India, is it? I've seen headlines about cases rising elsewhere, too.
That's right. It's not isolated at all. Other countries are seeing increases, too. China, for instance, has apparently brought back some local lockdowns in certain areas.
Hmm.
We're also seeing rises in South Korea, the UK. They had a big daily jump recently, something like 60%. Finland, too, even higher, like 100% daily spike reported. And parts of the U.S. are seeing regional increases.
Wow. Okay. So it is a wider trend. Did the WHO give any global numbers recently?
They did. For the week of March 7th to 13th this year, 2025, they reported an 8% increase in new COVID infections globally.
8%.
Yeah. And sadly, over 43,000 deaths reported worldwide in that same period.
43,000. Gosh. That really puts it in perspective.
Yeah.
It's still having a major impact, even if it feels less immediate sometimes.
Exactly. It's a sobering reminder.
Okay, so given all that, what's the practical advice for people listening right now? What can they actually do to stay safer, protect themselves, their families, communities?
Well, a lot of it is stuff we know, but it's worth repeating. First, think about wearing a mask, especially if you're indoors in crowded places. Simple, effective.
Right.
Keep trying to maintain some physical distance where you can. Wash your hands frequently and properly. Soap and water is best. Look after your general health, good food, bit of exercise, enough sleep that helps your immune system.
Makes sense.
Definitely make sure you're up to date on your vaccines and boosters. That's key. Try not to touch your face too much. And honestly, if the news cycle gets too much,
Yeah.
it's okay to switch off for a bit. Watch something funny. Do something you enjoy. Take care of your mental health, too.
That's really good advice.
Yeah.
All very sensible, practical things. So, looking ahead then, what's the big picture here? Is this just the new normal, these waves coming and going?
Well, this latest rise is definitely a nudge, isn't it? A reminder not to get too relaxed about it. The virus can and does evolve and cause surges.
Yeah.
But, and this is important, we've also come a long way. Governments, scientists, healthcare workers are all constantly monitoring, adapting.
Oh.
We understand the virus so much better now. We have
Got it.
vaccines, we have treatments. And think about those surges since 2022. They have generally been shorter, less overwhelming. So yes, vigilance is needed, absolutely. But there's also room for some, let's say, cautious optimism.
Cautious optimism. I like that. Grounded in reality, but hopeful.
Yeah.
Okay, as we wrap up this deep dive, what's the final thought you want to leave listeners with?
I'd say stay informed, but be smart about where you get your information. Stick to reliable sources, WHO, your national health ministry, like the Indian Ministry of Health. Try to tune out the noise, the sensational stuff, the unverified rumors that fly around.
Yeah.
Ultimately, we have the tools. If we all chip in, use those preventative measures we know work, we can manage this. We really can.
So keep living your life, watch those shows, bake that bread, enjoy things, but just keep that awareness ticking over in the background. Don't let it rule your life, but don't ignore it either. Stay sharp, everyone. Thanks for joining us for this deep dive.